Hello. Ọlọ́run àwọn dádì wa. Ọlọ́run. Hey, sorry. I don't know why I started singing. So sorry. I'm not supposed to sing. Welcome in. Welcome in. Welcome in. My name is Sasha Tobes, and today we supposed. Yeah, ignore my hair. I'm currently curling my hair so that I can use it for what's the name? Um, yeah, I just rolled my hair. I don't know. But welcome in, welcome in, welcome in. Today we want to talk about hormonal imbalance, and I have my laptop here so you can ask me questions regarding PCOS, hormonal imbalance, and whatnot. Let me see. I don't want two highs. What do I want? Pull. Have you ever heard of PCOS before? Have you ever heard of PCOS before? Where's the question mark? Maybe. So please let me know what's your take. Have you ever heard of PCOS before? Have you ever heard of PCOS before? Before we start today's topic, I want to ask a question. Have you ever heard of PCOS before? If I ask you what is PCOS, have you ever heard of the word PCOS before? So before we start today's class, please, if you have a question, please go ahead and ask me. You can please help me like your screen. You can help me tap. I'm here to educate. I'm not smarter than everybody. No, that's not why I'm here. I just want to like educate and just let you understand one or two things about PCOS. Please, you can go ahead and ask the question, answer the question. Have you ever heard of PCOS before? Have you ever heard the word PCOS before? Please go ahead and ask. If I ask you, what do you believe, what do you understand by PCOS, what would you tell me? What is PCOS? If I ask you, what is PCOS, what are you going to tell me? Let's have a class. We're having a class today. Have you ever heard of PCOS before? We're having a class. Please go ahead and answer me. Welcome in, welcome in. I want to be doing this 1 hour class every day. I will pick a time and we can, don't worry, my setup will get better as time goes on. But right now, this is the setup we are having. Yeah, number one, PCOS is also known as hormonal imbalance. So 4 people voted and I think only 3 people said no, they've never heard about it. So today you'll be hearing about PCOS. So if I ask you, what do you think PCOS is? What are you going to tell me? If I ask you, what is PCOS? What are you going to tell me? So what is PCOS in your own word? What is PCOS in your own word? Now, PCOS is hormonal imbalance in females and can cause a whole lot in a woman. Now, PCOS is, like I said, it's called hormonal imbalance. This is when the hormones of a woman is not balanced. Your hormones are not balanced. For those of you who know me, I always talk about PCOS a lot. That's because I have Polycystic Ovary Syndrome. Thank you so much. I like you. Fanbox, thank you so much for answering that. Yes, polycystic ovarian syndrome. It can also be known as hormonal imbalance. Can be classified clinically and into several types based on the dormant underlying mechanism. So we have different type of PCOS. For me, I have insulin resistance and high testosterone, meaning my testosterone is very, very high compared to other ladies. Also mean I also have insulin resistance, but we're going to be starting with endocrine. That's hormonal PCOS. Primary problem is dies is regulation of the hypo. Oh my god, let's use a simple English. This is very hard English, very, very hard English. We have the endocrine. These ones are the very, me I call them oga pata pata. ENDOCRINE. These ones are the oga pata pata of PCOS. For ladies who have this type of PCOS, you will notice you have your lack of period, irregular menstruation or absence of menstruation. Some of them, they may not see their period in a year. You might not see your period in a year. The core issue is an excess of androgens such as testosterone and often insulin resistant. Thank you so much, sis. You see pimples. Now let me show you, there are different type of pimples. You want to know that this person have PCOS, you will see the pimples from here. Here. No pimple will not be here. Here. Like a beard. Then you will hear of alopecia, lack of hair in the front, then androgenic and polycystic ovarians on ultrasound. Like when you do ultrasound, you now see those polycystic ovarians on ultrasound. Those are where you know you have androgen. We also have insulin resistance. That is what I have. This is insulin resistance and hyperinsulinemia. Insulin stimulates ovarian androgen production, reduce SHBG, increase free testosterone. Now, one of the people, like I said, I have insulin resistance. This helps. This is associated with weight gain, especially centered obesity. I have high risk of type 2 diabetes. What else? For insulin resistance, we also have, apart from weight gain, type 2 diabetes, you also know, you also notice that some of us have insomnia, one other thing, insomnia and loss of hair. What else? Lack of period. You can't find your period. Just know that, yes. Then we also have the inflammatory, which is worsening insulin resistant. When you begin to, even if you drink water, you get swollen. If they touch you, you will know you're swollen. You just notice that sometimes I will look like puff. Sorry. Let's do layman English. I don't want to use, sorry, I had a note ready for you guys. That's why I'm looking at my laptop. I have a note ready for you guys. I just want to tell you the type of, we have the inflammatory pieces. That's the higher level of insulin resistance. This one's your body is like inflamed. Any little thing, you are swollen. I call it swollen. There sometimes you do like this, your body begin to retain water, begin to retain fluid. This is a worsened insulin resistance. Then these are the clinical signs. We have fatigue, elevated inflammatory markers, often worsen other PCOS type. Now we have the adrenal PCOS, which is related to stress. There are some people that stress, acne, and then we have the post-pill type of PCOS. This one is the one that's temporary suppress of ovulation. Those ones that you use them after. This is why one of the reasons why I advise some people that please do not use all those contraceptive medication after your child. You say, I don't want to have a child no more. You now go and take the after pill. Next thing, insulin. You now notice that you're adding weight. Temporary suppression of ovulation, and symptoms may mimic PCOS because of it. This one is, this post-pill PCOS is usually reversible within months. That's when you take care of yourself. Now, let us talk generally before I continue talking about PCOS. So I'm done with those ones. So we have different type of PCOS. This is layman conversation. This is just something I wrote to start up with. We have I have talked about the insulin resistance and androgen. I've spoken about the high testosterone. There's one that you have that your boobs retain milk. What prolactin? Is it hypolactin? Yeah, I think that's the name, hypolactin. And we also have the post pill. Now, generally, for you to know if someone has PCOS, you're going to know by, you're a lady. Number one of the things that PCOS causes is infertility. I've been dealing with PCOS for a long time, so I'm going to tell you infertility is number one key thing we deal with. So number two, okay, before infertility, we should first of all talk of irregular period or infertility. So we're going to join that together. So for those of us who have PCOS, you notice that your period are not regular. This is where I advise ladies to go and download Flow, FLO. This is an app that helps you to track your period, track your ovulation, and etc. Now, you should go and also get, you should also go get, please, if my son, sorry guys, I don't know, can I pause this thing for a minute? Honey, can I ask for your help for 1 second? Honey? Ed? Honey? Okay, guys, let me turn on the lights. So I want to make sure that you guys can see me properly during the live, because it feels like I'm a little bit dark. So that's why I want to get up and get this thing. So we're going to have conversation, and I want to make sure that our class is something that you ask and I respond. We are doing a respond and ask class. So I ask you and you respond. Sorry, I forgot about the light before coming up. I should have done my ring light. I forgot about it totally. So let me get the lights here so it's easier. I should have brought a pen and paper, but that's fine because I would want to like write as I speak. Writing and speaking makes more sense. So my next live, I'm going to be talking about losing weight with PCOS and the challenges with it. But today, let's just generally talk about PCOS. Okay, let's end. How do I end this poll? Okay. So thank you so much for answering. Drag here to end the pool. Yeah, we just ended that pool. Good, we just ended the pool. So have you ever heard of PCOS? 56% said yes, and 44% said no. So moving forward, I want to talk about the whole type of PCOS and how to know you have PCOS. So growing up, I noticed that when I'm like stressed, I get bigger. Then when I'm not stressed, when things are going well for me, I start to lose weight. It's very weird. Now, one of the things that PCOS does is you don't need stress. Stress had more problem to you than good if you are dealing with PCOS. And PCOS is commonly seen in a woman, not a man. But if you're a man, you can come here and learn from what I am telling you, because you might be married to a lady who is dealing with PCOS. Now, how to know your wife or you have PCOS? You see, there is this kind of airline that you will just know by our airline. The airline alone is enough to know. We have what they call PCOS. I call it PCOS body. The under tummy and the overly big arm. That's another sign of you have PCOS. It's not a sign, but please, if you think you have PCOS after listening to me, you can as well go and see a doctor. That's your cookie, please. This is why I want to be having this. No. Take this one. So please go and see a doctor if after listening to me you think you might have PCOS, irregular period, and infertility. If you've been married for 2-3 years and you are not pregnant, there might be a problem. Now, another thing with PCOS is it affects the mental health of a lady. You'll notice that sometimes your moods are dancing. I call it dancing mood because in the morning you can be fine, you can be smiling, you can be in the best mood, and in the afternoon you're squeezing your face, you don't know what is wrong with you. So it affects the mental health of a woman. So if you know you have a lady that, oh, she's too hot-tempered, she might just be dealing with hormonal issues. Oh, that lady is so nice, but oh my God, don't cross her, hormonal issues. So it also affects the mental health. That's what I want to say. So infertility, we've spoken about infertility. Let me get a pen and paper so I can know what I've spoken about. I wish I have a pen and paper here. Honey?
Hi.
Please, can you get me a pen and paper? One of those, your printer paper, please. 1 or 2. I want to be able to write things. Thank you. I want to be able to write things so that it's easier for me to know what I'm saying. So, keeping up, please, if you have a question, please go ahead, and if you want to put in banana, welcome in, welcome in. So today we're just talking about it generally. We also have I spoken about stress. I've spoken about infertility and irregular period and infertility. Hold on, because I want to be writing them so I don't forget. Irregular period and infertility, stress. Then did I talk about the hairline? And the hairline, your hairline, you have hair where you shouldn't have hair, but you don't have hair where you have hair. Hair loss, or having hair where you shouldn't. Like now, you will see hair here, like beards, hair on your chest. Now let's talk about acne too. Now acne here, you see it here, and you can also see it on your chest. That might be sign of hormonal imbalance. What else? Insomnia. Insomnia is issues where you don't sleep at night. At night you can't sleep, you're having restless nights. Number 6 is also, guys, if you know anyone, please, can you please give me, let's hear from you. So number 6, we also have, I remembered when I've forgotten, I've spoken about hair, I've spoken about hyperpigmentation. Not every lady you see that their body is not even is actually bleaching. Some ladies are just dealing with hyperpigmentation. So another one is hyperpigmentation, when your skin are not even. That's hyperpigmentation. We've spoken about mental health issues. Another thing we should also talk about, okay, now if you have PCOS, you are prone to diabetes, asthma, headache. I'm adding headache because sometimes I just have headache. So I'm putting that one as a one line. You're prone to some, because your hormones are not normal. So you're prone to some kind of health issues that you cannot explain. Now, now it is important to note that PCOS cannot be reversed, but it can be controlled. Like, it can't be healed, but it can be reversed, it can be controlled. Now, how can you control it? By losing your weight, staying away from stress. Make sure you download the Flow app so that you can be able to track your period. You are able to track your hormone system. Now, how can you track your hormone? By using the Flow. Like now, you record every minute, every day that you do your period, record it down. when you record it, it will be able to tell you how many months maybe your period is regular or irregular. Remember to use supplements like Flow, metformin, inositol, or ovasitol is very good for you. I have actually spoken to ladies, and for those ladies who are TTC trying to conceive, I have always told them try Flow. Today is not the topic for that. I'll come back, I'll list out the names of the supplements to use, or maybe I'll do a video. I'll try and sit down in front of camera and do a video and list out the names of supplements to use to conceive with PCOS. But today I just want to do a general conversation on PCOS. PCOS is common among, is currently affecting, let me say 70% of women. PCOS is so bad. PCOS can be genetic, it can be environment, and it can be because of post-pill. It can be because of change of environment, or spoken environment. And PCOS can also be as a result of your recklessness. So please, ladies, I would advise, as a sister to a sister, please make sure you're liking my video. Make sure you're tapping on your screen. Please, I'm going to say this out of love. Please try as much as possible to make sure you're living a healthy life. Living a healthy life can also help you to live good. If you know you have PCOS, make sure that, and you have children, make sure that you're watching out for your daughter. Now, PCOS can affect from between teenager to a woman that is close to menopause. And do you know that research have shown that women with PCOS are likely to die before the age of 60 because of what's the name? Because of the PCOS. Because when you have PCOS, your hormones are not working right. Your ovaries are not working right. Like, now imagine having cyst in your, and you don't know about it. Before you know, that can turn to something else. So, and women with PCOS tend to have cancer, and research have shown that before the age of 60 they are prone to, to be out of this world. I would say this out of love. If you know someone who is dealing with PCOS, please try as much as possible to keep your opinions to yourself. You can't tell them to lose weight. It's none of your business. You don't know what they do in secret to lose weight. You don't know how much they've spent. So the only thing you can do is tell them love and light, or just be nice to them. Because at the end of the day, you talking about their weight is stressing them more. You might be surprised that they might be 230, and because you spoke about their weight, you've added to their stress, their mental health is down, and the next thing they've added to another 250. So you're not helping it. Ignore. It is not your place to talk about a woman's weight. You don't know the health challenges. You don't know the health issues that woman is currently going through. Now, my next program, I'm going to be talking about the issues PCOS women go through. Now, when it comes to PCOS, like I said, getting pregnant can be very, very difficult. Getting pregnant is one of the most difficult things a woman dealing with PCOS can. Sorry, guys. Yeah, fertility. Oh, I'm in pains. Fertility issue. As someone who've had 2 babies, yes, I've had 2 children, and I have PCOS doing the both. And someone who have lost weight 3 times with PCOS, I will let you know that stress is okay. Sorry, guys. I don't feel too good. My hand to my chest hurts. So, ladies with PCOS after giving birth to can take 2 to 3 years to heal. not everybody is the same. I'm going to be talking about this. I don't want to be jumping topics when it comes to PCOS. I want to be picking it one after the other. Fertility is one topic I love to talk about with PCOS because I have overcame that twice, and I really want my other sisters to overcome it. So one of the videos that I'm going to be posting is we'll be talking about supplements to use if you're trying to get pregnant, and step to use as a PCOS patient. With PCOS, your life is changed, and I honestly, oh God, what is wrong with me? Something is wrong with me, and I honestly feel that PCOS should be made a disability. Honestly feel like that. One of the things I would want to say is, if you have PCOS, make sure you are resting. Not just rest, I mean 8 hours a day kind of rest. Make sure you are resting. Make sure you take that rest. You need that rest. As a PCOS patient, you need your rest. You need your beauty sleep. You need to be able to rest. That's number one. Then if you have PCOS, make sure you're taking supplement like Ovacitol, Inositol, or Mefo. I can't remember the name. Mefos. Now, another cause of PCOS is that short-term memory. Mefo. Is it Mefoline? I can't remember. I'm cold. Guys, I'm cold, extremely cold. Oh, I might end the life soon. I don't feel too good. Oof. And Inositol. So when you use your supplements like that, then another supplement you should add when you're using any of those first one is for you to also get your vitamin D, vitamin E. Make sure you're checking your iron level. Like me now, I'm anemic. I'm extremely anemic. See now, you can see this is PCOS. I'm anemic, extremely anemic. So, and I have insomnia too. So for you to work on your insomnia, make sure you get you can also get melatonin for that. Remember, our body also absorbs medication, meaning when you use this medication for 3 months, it doesn't work again. So after 3 months, it's well for you to, okay, I need to go. There's something I need to go and rest. I don't feel too good. I actually wanted to have like a very nice class. I actually wanted to converse with you guys. Unfortunately, I don't feel too good. So what I'm going to do is I'm going to make it into a video. I'm going to sit down in front of the camera when I feel a little bit better, and I'm going to have a full conversation. But before we go, let's go ahead and finish listing the supplements for PCOS. CoQ10 too is very good. Honey? Sorry, I think it's CoQ9, not CoQ10. CoQ9 is very good. Fish oil, omega-3. That omega-3. Then, which other one? Folic acid too is very good. If you're TTC, add that. If you're not, you can remove that. But fish oil, omega-3. Did I mention CoQ10? Your iron supplement, make sure you're checking your iron level. Which other one is there? Which other one? Vitamin E, vitamin D. You need those, your vitamins. What other one? Is it finished? I think it's finished, but I'll check my list because I have a list of my supplement, and I'll let you know. This actually work, and you need all those supplements. If you even try and lose weight, you need those supplements, because those supplements has what they are doing in your body. Because when you have those nutrients to help you work your body, to let your body work well, even if you are using a weight loss supplement or a weight loss medication, then that works. So I think one of the reasons why my weight loss medication is currently not working, because I'm only using Flow. Now imagine if I had CoQ10, omega-3, or the other supplement I used to use, your hormones are going to get balanced. They're going to get better. So whatever weight loss medication you're using would now make you work. I don't know if you understand. Okay, I'm going to just wait for my son to be asleep so that it's easier for me to do this class, because I can't do this class with him always like distracting me. So thank you so much for joining. This is just 30-minute class. If you have any question on PCOS, please go ahead and comment it. I am going to attend to all your questions in the video, or we can as well wait till first thing in the morning when the kids are sleeping, my husband is sleeping, to do this live again. Lot of love. Thank you so much, and bye-bye. Let me go and sleep.